With respect to treatment options, there are several options, the goal of which is to ensure that people with Parkinson's enjoy as productive and active a lifestyle as possible, with good symptom control and independence. It is strongly recommended that people with Parkinson's be assessed and managed by a movement disorder specialist, or if this is not possible, then by a neurologist. Treatment for Parkinson's is typically started once the symptoms affect activities of daily living, and choice of therapy is best individualized by the doctor in consultation with the patient, family, and caregiver. Medication is the standard form of treatment, and it helps reduce muscle rigidity, improve speed and coordination of movement, and lessen tremor. Medications for Parkinson's are effective, but determining the optimal dose can be difficult. Also, the number of medications available make treatment choices complex. Medications alone are not the best form of management of Parkinson's. Parkinson's is best managed by medication, along with exercise, emotional support, and rehabilitation, such as physiotherapy, occupational therapy, or speech-language pathology. Once all medical options have been exhausted, surgical treatment may be considered. Neurosurgical treatment is beneficial for certain patients, but it is not a standard form of treatment for all. There are several available surgical options, one of which is deep brain stimulation. This involves implanting electrodes deep into the brain and stimulating that area of the brain using a pacemaker-like device. With respect to medication, the goal is to increase dopamine levels in the brain. Dopamine is not stored well in the brain, so dopamine replacement in several doses over the day helps keep dopamine levels consistent. For the treating physician and patient, medication management is always a question of balancing symptom control with the fewest side effects of medication. One thing that's important to know is that response to medication differs from person to person. There are two categories of Parkinson's medications, first line and second line. The first line includes levodopa and the dopamine agonists. Levodopa is the gold standard of medication, and it comes in a generic form and a brand name called Sinemet. All people with Parkinson's will eventually be using levodopa. Levodopa is converted into dopamine in the brain, whereas the agonists mimic dopamine at receptor sites in the brain. The agonists are used as monotherapy or in conjunction with levodopa. The second line of medications include COMT inhibitors, MAOB inhibitors, amantadine, and anticholinergics. There are two enzymes that break down levodopa in the brain, COMT and MAOB. COMT inhibitors lengthen the time of action of levodopa by blocking the enzyme COMT. This allows more dopamine to enter the brain. MAOB inhibitors work like COMT inhibitors, and they block the enzyme MAOB. Amantadine has a mild anti-Parkinsonian effect, especially on tremor, and it has also been found to reduce dyskinesia. The mechanism of action, however, is unclear. The anticholinergics have modest effect on symptom control, but several side effects, such as dry mouth, constipation, and memory impairment, so they are rarely used. Amantadine and the anticholinergics are poorly tolerated by the elderly, and they often cause confusion. A key point about all Parkinson's medications is that the timing of dosing is extremely important. Parkinson's medications given late, at all late, even within a half an hour, can lead to severe loss of function and patient anxiety. It's important to make sure people with Parkinson's get their medication on time. This will not only help them to function better, but will help you in providing care to them. When giving Parkinson's medications, it's important to follow the prescribed medication schedule. A watch with a timer can be helpful to remind patients to take their medications on time. It's very important never to stop Parkinson's medications abruptly without consultation with a neurologist, because this could cause a potentially harmful episode of neuroleptic malignant syndrome, which is instability in the autonomic system. NMS occurs when regular dopamine cycling in the brain is starved, such as when Parkinson's medications are suddenly stopped. All Parkinson's medications have side effects, including nausea, vomiting, dizziness due to drop in blood pressure, confusion, and hallucinations. In addition, each medication has its own side effects. Nausea is a common side effect of the medications, and to avoid this, Parkinson's meds are often started with meals. Nausea may resolve on its own, but if it doesn't, the addition of domperidone will control it. Domperidone blocks the peripheral side effects of nausea and dizziness due to the drop in blood pressure. It's important to report all side effects of medications to the person's treating physician, as adjustments in dose or the addition of medications may be necessary. That brings us to the end of this section on the treatment options of Parkinson's. Thank you for watching. This presentation has been developed by Parkinson's Society British Columbia, and should you like further information, please feel free to contact us. If you are watching this presentation in order, the next segment will cover the cognitive and mood aspects of Parkinson's disease.